This is Takoa Rogers, family nurse practitioner student at Albany State University. Today I'll be performing an adolescent assessment. This is Jacoby. He's 11 years old. Jacoby is being brought in today by his mom for a well check visit. Mom states that Jacoby hasn't had any problems since his last visit. He lives at home with his mom and dad and two siblings. He has one sister and one brother that are both in good health, have no health issues at all. Mom states that Jacoby's done well. She is somewhat concerned about his sugar intake, concerned that he may possibly be overweight and that he is eating a lot and afraid of the amount of sugar that he's taking in. So we did some education on that. Educated mom on decreasing sodas and juices and increasing his water intake and giving him water and milk for beverages instead of the sodas and the juices. Mom states that activity-wise, he's appropriate. Jacoby knows how to ride a bike. He's a good reader. He's actually reading on an 8th grade level, even though he's in the 5th grade. Mom states that he does well in the gifted program at school. But he does like to sit on the couch and play video games a lot and doesn't go outside much. So there was also some education done on that sedentary lifestyle and encouraging him to get out and be active, ride his bike, and run and play more to burn off some of that energy and some of that sugar. Developmental wise, Jacoby is developmentally appropriate and he answers questions appropriately for his age range. With growth and measurement, Jacoby weighs 94 pounds. He's 59 inches tall. So his BMI is around 19. And educated mom that with that, he is not considered to be overweight. But again, she can monitor the sugar intake, the juices and the sodas and that type of thing if it's a concern for her. Vital signs, his heart rate was 90, respiratory rate was 18, his temperature was 98.4, checked orally, and his blood pressure was 97/60, all within range for him. We'll look at his skin. Jacoby's skin is normal in appearance, it's normal for his race. His mucous membranes are pink and moist. There's no dryness noted in any of the mucous membranes when we assess those. His skin is very smooth. There's no rashes. There's no lesions. It's warm and dry to touch. We can move on and look at his nails. There are no ridges and no discolorations in the nails. While we're looking, we can check capillary refill, and it is less than 2. Looking at Jacoby's hands and feet, we can look at his palmar creases, and those are symmetric, which is normal for him in the center of the hands. There's no deformities noted to his feet or his hands. Gait is steady, no difficulty walking, and he has symmetric strength in his hands and his feet bilaterally. Then we can move on and look at Jacoby's head. We start at the top, which says the hair. His hair is a black color, kinky texture. It's evenly distributed over the head, and there is no infestations noted there. We can go ahead and feel his skull. It's very firm. There's no lumps or bumps noted there, no discolorations, and we can look to see that his head is actually midline to his trunk and to his shoulders as well. There's no difficulty, no abnormalities there. The head is normocephalic, and the skull has no deformity. Scalp is clean and atraumatic. We move on to the lymph nodes. We can feel those starting behind the ear and move down the neck. And also we can check in the axilla. And what we're feeling for is any enlargements or any movements, and there's none noted there for the lymph nodes. Looking at the neck, again, no lymph nodes are noted there to be enlarged, no movement there. The neck is symmetric there to the shoulders. And we can check the carotid while we're here. And we would check those one side at a time and note that they are bounding and regular. Trachea is midline. Have you swallow for me? And there's no deformity there. You feel a nice, smooth up and down motion when he swallows there. And then we can move on to his eyes. And when we look at the eyes, we'll assess the conjunctiva. Note that there's no drainage, no irritation, no redness, no swelling at all to the eyes. The sclera is clear. The corneas are clear. And we can assess the pupils here. Touch your head back for me. pupils are equal, round, and reactive to light. And we can look further. Look over my shoulder, straight ahead for me, okay? Straight over my shoulder. Straight over my shoulder for me. And we can also check the red reflex. We would dim the light for that, stand back and shine into the eye and check for red reflex, and that is a normal finding and should be there. And if it's not there, then referrals should be made. We can move on and look at the ears. On assessment, we don't see any drainage there. Note that the pinna, they're evenly aligned and symmetric to the head. The outer ear has no abnormalities there, and again, no drainage is noted to that. And then we can assess the inner ear. And the tympanic membrane is pearly and gray, shiny there. And again, it's visible on this side. There's no redness, no irritation, no swelling or abnormalities noted in the inner ear either. And we can move further and look at the nose. We don't see any type of drainage or irritation or redness noted there. The mucus lining is pink and it's moist and patent, and the septum is actually midline there. The nares are patent. No stuffiness or no congestion, no complaints there. And once we do that, we can move on to look at his mouth and his throat. And what we're looking here, we'll look to make sure that, open up for me, say ah, ah. Pull your head back, all the way back, ah. Open your mouth wide, ah, ah. Stick your tongue out. The tongue is midline. The mucous membranes are all pink and moist. There's no fissures. The palate is smooth with no discolorations noted there as well. There's no dental caries noted. Okay, you can close. No dental caries are noted, and his dentition is good. Mom states that he does have regular dentist appointments. And then we can move on to the chest. The thorax is appropriately shaped and proportioned. He has an even rise and fall there. And we'll go ahead and listen. Start with the heart sounds. And we'll listen to our aortic. Pulmonic. Tricuspid. And then we listen to the mitral. Put your arm down. Very good. And there are no abnormal sounds heard there. The rate is even and regular. And then we'll move on and listen to the lungs. Deep breath in and out for me. Open your mouth. Breathe in. And blow it out. Open your mouth for me. Breathe through your mouth. Very good. Again. 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 Okay. Okay. And again. The lung sounds are clear. The respiratory rate is even and unlabored. No adventitious sounds are heard there. And then we can move on and check the vascular. When we assess the vascular area, we're assessing the pulses. Again, we've already checked the carotids. We check those one at a time. We can check the brachials here in the bend of the arm. And we will check each of these for a full minute. Radial in our wrist. Then we can do the femoral in the thighs, popliteal behind the knees, and then we can move on to the pedal pulses. And they are strong and bounding there, and we can check capillary refill in the toes and in the fingers, and it is less than 2 seconds. And I'm gonna let you lay back for me here. When we do our abdominal assessment here, first we would listen. Want to listen to the bowel sounds, and we will listen in all 4 quadrants. And we would listen for a full minute in all 4 quadrants. And then we can palpate, light palpation. And there's no pain. No masses are felt. And then we can do deep palpation. Breathe in, deep breath in. Okay, very good. And then we check the musculoskeletal, and we're looking at the joints. All the joints are intact. There's no deformities, and he can move all of his joints. He has full range of motion in all joints with no crepitus and no abnormal sounds heard when he moves, no complaints when he walks of pain, and his gait is steady. That concludes our assessment.